Tonight, we're hearing from a mother who lost her daughter to the opioid crisis in September. She lives in the Brant area, which is seeing an increase in overdoses and deaths this month. As Maria Saru tells us, the hard-hitting district has been fighting the crisis for years.
There's a lot of pain that we go through now.
Krista Cabral wears her daughter's ashes in a heart-shaped pendant around her neck. At just 33 years old, Brittany Silvestre died of a drug overdose in a Brantford apartment, leaving behind a baby girl.
Brittany loved to laugh. She had a really good sense of humor. She loved music. She loved her daughter.
When Silvestre overdosed, a friend doused her with cold water and revived her with 2 doses of naloxone, a life-saving medication that can reverse the effects of opioids. Brantford police arrived at the scene, responding to a noise complaint. Officers asked Silvestre if she wanted medical help. She refused.
Police left and no one heard from Brittany all day.
A few hours later, a downstairs neighbor found Silvestre face down in her bed, very stiff. Since then, Cabral has been spreading awareness about the limitations of naloxone.
My daughter thought that she would be okay, and naloxone did not save her, and it won't save you.
Silvestre is one of many people who have died of drug overdoses in Brantford-Brant this year. It's an issue that experts say the district has been grappling with for a long time.
Brantford-Brant consistently has an increase or an elevated overdose and death rate compared to the province. I really do want to emphasize that it is a crisis in our country and in our community.
The district is reporting a spike in overdoses this month. Between November 1st and November 27th, the local health unit recorded 27 suspected drug poisonings. While the exact cause hasn't been identified, the unit suspects fentanyl and benzodiazepines, as well as a contaminated drug supply. But they're taking steps to address the problem by promoting online safer consumption services like the Brave app, which connects people with remote supervision online, as well as the National Overdose Response Service.
We're also piloting a fentanyl test strip pilot, which distributes fentanyl test strips to community members.
Todd Gould at the Grand River Community Health Centre says naloxone is a first step that should be followed by emergency services. It can be a short-term intervention, but not a solution. Like all medications, it has a half-life and expires over time. It also may not work on benzodiazepines.
It doesn't address this heavy sedation that occurs when people have these benzodiazepines in their system.
He adds that addressing the overdose crisis is extremely complex and requires collaboration from all levels of government, as well as local boards and associations.
If they're housing insecure and home insecure and financially insecure, that really puts people right back into risk.
Maria Saru, CHCH News, Brantford.